Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.
Richard Sarnwick of Shawano is a Democratic candidate in the 6th Assembly District. Mr. Sarnwick, welcome to WisconsinEye.
Thank you very much.
As a physician for more than 30 years, I notice on your website one of your goals is to do more to treat opioid epidemic, the addiction. You want a clinic in Shawano. Can you talk to me about the next steps you think should be taken to confront not only opioids but methamphetamine and heroin?
Well, it's a gigantic problem in society. I think 60,000 people last year died of drug overdoses in the United States. It's a gigantic number. And, you know, many people in Wisconsin have family members or friends affected by the epidemic. So one of the things that works for opioid treatment or opioid use disorder is maintenance therapy with either methadone or Suboxone. Mm-hmm. And the favorite right now really is Suboxone rather than methadone. So right now I'm working on a collaborative effort with the company I work with, management there, myself as well as 2 other doctors. We're trying to get together an opioid treatment clinic in Green Bay, and we hope to bring that clinic to outlying areas in the future. The emphasis right now is just to get it done in Green Bay and then move from there. But also, I'm hoping that, you know, I work with a large healthcare organization with a lot of other family practice people, and I'm hoping that if the 3 of us doctors get this thing going, then other people will be willing to step up to the plate. It's a difficult part of medicine to treat people with that disorder. Takes a lot of time and effort, but hopefully if we get this thing rolling, we can enroll more family doctors into it and get help for this portion of our society.
And then a broader question, how can we protect and maybe expand healthcare in rural areas like you want to represent, sir?
Well, that is a tough one. When I went to medical school and graduated in 1981, and at the time, the United States had a program for medical students, and if they agree to work in a health manpower shortage area mm-hmm. after they graduated, then they'd be eligible for scholarship funding. So what happened then is a lot of people actually did end up in the sticks, like me, mm-hmm. and they stayed there. It worked pretty good. So if there was a national effort to reintroduce that program, that might be an idea. But on a state level, if the state was willing to do something like that, that would be good as well. Another thing that happens, though, is that medical students go to medical school, they pay tuition, then medical schools contact doctors, family doctors who are out in the sticks, and they say, can you guys or women take a student for 6 or 8 weeks? So, and part of the reason that that program works or doesn't work is because every time a family doctor like myself agrees to do that, we get home an hour or 2 later. We do research at night. It's a very intensive effort. So if there was some way to help fund physicians who are willing to take on students, that might help introduce medical students to rural practice as well. You know?
Do you think Wisconsin's Medicaid reimbursement rates are so low that it's almost a tipping point that threatens the quality of care provided under our MA program, sir?
No, I don't, and okay. I'll tell you why. I think most family doctors like myself, we work for large healthcare organizations. And a lot of us are salaried in some way or another, especially if we work in rural areas. Otherwise, we couldn't afford to provide that care in rural areas at all. So most large healthcare companies are willing to help fund that part, even though the reimbursement rates are lower. If we see people with medical assistance, we don't feel it directly. So as far as family doctors are concerned in rural areas, I think the way it's working is working. It may not be the greatest thing for large healthcare companies, but family doctors are paid to be out there.
Have you followed the state and Delta Dental pilot program that provides dental care to low-income residents in some regional clinics? Is that something you followed? If so, do you think it should be a priority in the state's next MA budget?
So, I'm a family doctor, and I've been out in a rural area for years, and decades. And when I see people with medical assistance, and I do their exam, and I look at their mouth, a lot of people have really bad teeth. And we've all heard about what happens, or maybe people haven't heard, but a lot of people end up in the ER where they're treated with a pain pill and an antibiotic. It doesn't really cut the mustard. Or they come in to see me and it's the same thing. So what I see in reality is that a lot of people are still hurting for the dental care, and I think it should be funded because the dental health issues, it has a big impact on people. When I see people with medical assistance, a lot of people have teeth that are not in good shape by the time they're in their early 30s, certainly by mid 30s or early 40s. It's kind of a disaster, the dental care issue. It's hard for people to get into dental clinics as well. So when I see people with medical assistance and they live in Shawano or other rural areas, it isn't just trying to find somebody, it's trying to find transportation. So it's a big, difficult deal for those people.
Have caregivers raised an issue with you? The AARP estimates that 578,000 Wisconsin residents are caregivers for a family member or a neighbor or a loved one. So I wonder if you would support laws or rules that require hospitals to recognize and work with family caregivers when a loved one is hospitalized. Is that an issue that's come up?
Well, for your question, I'm a little confused with that. Does that mean that if somebody gets into the hospital, then the family member or the neighbor would be entitled to receive medical?
Someone who is not a family member, someone who's been providing care, but may not be a family member, so they may not technically have the ability to work with the patient and the caregivers. Is that an issue that you've?
It's an issue.
It is.
So I saw a fellow last week, and he was an older fellow, Polish, from Chicago, but he's lived up in this area just for years and years. He had no family, so there are neighbors who took him in, and they take care of him. And I think he's like 78 years old, but...
Was the clinic or the hospital able to work with the neighbors since they weren't family members in terms of his care? We
do see him. He has a neighbor come right into the clinic office when I see him, so that's how that works. But if it's a question of whether neighbors should be entitled to medical information and help make decisions, it might be appropriate because some of those people are mentally disabled in some way.
On your website, you say that we should raise taxes on the top 5%, correct? And number one, why? Number two, where would you redirect the additional tax revenues that they would pay?
Well, I don't know if we would get additional, maybe we would get additional tax revenues, but okay. I think income inequality across the world and across the United States, as far as I can tell, income inequality is actually getting worse in many countries, and I think it produces a lot of problems, a lot of resentment. So how that money should be spent, I'm not sure how it could be spent, but having a better way to distribute income across our country, I think it would be beneficial for all of us.
On your campaign website, you call the Foxconn tax benefits tax breaks package environmental thoughtlessness. Why?
Well, in particular, because I believe it violates the Great Lakes Compact.
The diversion of the 7 million gallons, even though
at least 7
5
million. Some people have said up to 15 million gallons per day, and that's part of it. It all started, I think, in early 2000. There was a Canadian company that wanted to take money from the Great Lakes and put it in a ship and ship it over to Asia and sell it there. Yes. The Great Lakes contain 20% of the fresh water on our planet, and I think opening up the door to Foxconn, enabling them to put that giant straw into the lake, was bad enough, but I think it's going to enable other large companies to take the same step. A lot of the large industry needs vast amount of water, and if we allow it for Foxconn, I can't see why we would not allow it for other companies.
Do you also object to Foxconn and the request from Kimberly-Clark for similar tax breaks because it's bad public policy? When should state government help a private company?
So, Kimberly-Clark, I think that's a bad precedent to start funding companies that are having difficult economic times. I don't know where it would stop if you allow Kimberly-Clark to have that benefit. Why wouldn't other companies ask for the same thing? So I just think it's got to stop. I don't think it's good for our economy. As technology changes and companies change, I think that some companies are going to be winners and some are losers, but trying to support a losing company, if that's where they're at, it just may not work out.
What are your thoughts on how to break the impasse or the gridlock in the Capitol over how we pay for our highways in the future?
Well, there's different ideas I've looked at, and I think we've been putting Band-Aids onto this problem for years, and our highways and our bridges need repair. And instead, it's just been gridlock for years and years. I'm really in favor of tolling. When I go to the Chicago area to see my family, I expect to pay tolls to use the roads, and that's what I think we should do in Wisconsin.
Should we also consider raising the gas tax or the vehicle registration fee that you and I pay?
I just don't know the answer to that.
Okay.
If we're looking at alternatives, my favorite one right now is toll road. I know that takes years to put into place, but we've been dangling on this thing for years as it is. So,
the current state budget included more than $600 million more in state aid to K-12 schools. Do you think that's enough, or do you think our public schools are underfunded, Doctor?
Well, I think they're underfunded. Even with this additional revenue, I think we're going to need more money to adequately fund them. Wisconsin educational system was really a jewel for schools throughout the United States, and I think we've just taken a beating these last few years. I don't get it. Wisconsin educational system needs to be adequately funded. And I also have some other different ideas about that whole thing. One of the things that many countries in the world are doing right now is offering year-round school so that the schools don't sit vacant for 3 months of the year. Mm-hmm. If I had a small business, I wouldn't want it to sit vacant for 3 months of the year. The other thing that happens when kids get 3 months off, studies have shown that when they come back, they've lost 25 to 35% of the things they learned the previous year. So keeping kids in school, giving them frequent breaks, giving the teachers breaks, I think it would help out our educational system in Wisconsin. The other thing I'd like to see with education in Wisconsin is a redesign of the school day. I know right now that many schools start early so that after school kids can participate in athletics, but if all the schools in Wisconsin agreed to change their school day, I think the kids would get more out of it. Studies have shown that trying to get teenagers up at 6 in the morning to be in school at 7:30 doesn't work that good. So the other thing is that those teenagers get home then, their parents are still in work, they get home at 3:30 or 4 o'clock. There's a couple hours that just aren't well monitored. So I would also recommend restructuring the school day, start at 9 o'clock, get finished at 4:30 or something like that, and then figure out how to redo the athletic portion.
The voucher program has expanded to now it's statewide. Do you have a position on whether it should remain or be cut back?
Well, when I was a kid, I went to Catholic school, and I went to Catholic school 1st grade through 9th grade. My brother and sister did as well. My parents funded that. We paid tuition to have that done. So I am not in favor of taking taxpayer money away to fund private schools. I think right now the funding is estimated to be about $7,400 per student, and that money comes from public school funds. So I think we're stealing from the public schools, and I think public school education in Wisconsin was always well received. The teachers did a great job, and I think we are hurting our public school system by taking that money away. So I'm not in favor of that program at all.
State government has imposed levy limits on local governments to control property taxes for 14 or 15 years. Do you think we should keep levy limits to control property taxes, dial them back or loosen them, or get rid of them?
I'd like to keep them where they are. I think if a municipality or a city needs a major expansion, say with a school system or a pool or something like that, they should put it on a referendum. But I'd like to help protect our Wisconsin taxpayers by getting rid of the levy limits.
There will be a big debate over the Department of Corrections budget in the next state budget, the next legislative session. The Green Bay prison and the Waupun prison were built in the 1800s. Some Democratic candidates for governor said if you emphasized rehabilitation, we could cut our prison population in half. Do you think we need a new state prison?
I think we need a new state prison. And I also think some of the Democratic gubernatorial candidates are correct in trying to reduce the prison population. Right now, I think it's estimated that there's about 23,000 people in prison. Trying to reduce incarceration rates, I don't think you want to do it all of a sudden. I think you'd probably want to do that over a 3 to 7 year time period. Do that slowly. Try to get better sentencing guidelines for non-violent offenders would be good. I also think we should be spending more money in treatment-based probation. So if people are on probation and they need treatment for mental health or AODA issues, we should be funding those issues. Finally, I think we should be funding AODA treatment programs for the prison population who needs it.
Why do you back term limits? I think you had 4 years for the assembly and 6 years for a state senator?
Yeah. So I'm an old guy. I'm not going to be a career politician. And as I look at Wisconsin politics and where they're at today, I think many of the legislators are in office for years and years, and I think they receive money from organizations to help fund their campaigns. So they're either in the legislature for a bit, but then they're constantly fundraising, looking at ways to get reelected. So I think our founding fathers really wanted a country based upon citizen activity in the legislature. So they didn't, I don't think they foresaw a day where people would get reelected and reelected. I think we should have term limits for our legislators, and people should have a chance to serve. And I think it would remove a lot of the dirty money that's in politics right now. And as a matter of fact, 15 out of the United States right now have some sort of term limits, some sort of program for term limits for their state senate or state assembly.
Do you want to legalize recreational marijuana and tax it as a good public policy and a source of revenue, both, or which is the biggest reason for it?
Well, when we outlawed alcohol, that just didn't work out. And frankly, there's many people in Wisconsin who are smoking marijuana at this time, and they obtain, I don't know where they get marijuana from, but it's not taxed, it's lost tax revenue. Some people have said, what do you think about medical marijuana? You know, I just don't want to step into that swamp at all, because what happened in California when they did that was many people would come into their family doctor with hard to describe symptoms, complaints, and the doctors would be prescribing marijuana, maybe feel queasy about it, but that's what the person was asking for. I just don't even want to be in that quagmire. I would much rather have the state just legalize recreational use of marijuana and use those tax benefits to fund AODA or drug treatment programs or mental health facilities. You know, use those funds to bring mental health professionals into Wisconsin so that we could help people out. In Colorado last year, the tax revenue from the marijuana industry was $250 million. So I think that would, if we spent the money correctly, I think it would help our state out. It'd help out needy people, do drug treatment programs as well. And
then finally, do you want to highlight differences between you and the incumbent you're challenging on November 6th?
Well, Let me count the ways. First of all, term limits. You know, I'm in favor of term limits. My Republican opponent has been in office for a long time. I understand why he doesn't like the idea of term limits, but that would be one issue. Another issue is just the whole healthcare industry. My Republican opponent would like to keep the current system in place, but I just don't think the current system is working at all. What I see in my office in real day-to-day life, when Obamacare was in place, fully in place, I saw more people coming in and had medical care. But as things have gotten tighter in the past year or two, I have more and more of my patients who come in and they either have little coverage or they have really bad coverage. So I don't think that's working. The United States is the only advanced economy in the world that doesn't provide basic health insurance for people. So providing health insurance is one thing, but in countries that provide basic health insurance, there's other benefits as well. There's less suicide, there's less depression, and frankly, just less financial stress for people because they're able to have health insurance. Finally, I'd have to say that I think if we were able to, in Wisconsin, have basic health insurance for people, I really think it would help draw young people from other areas of the country, talented young people, to our state because they'd be willing to take a chance on new business. And small business is really the engine, I think, that drives the U.S. economy.
Thank you. Richard Sarnwick, of Shawano, is a Democratic candidate in the 6th Assembly District. The election is November 6th. Mr. Sarnwick, thank you for talking to WisconsinEye.
Thank you.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.